Hi everyone and welcome to the Lakeview video podcast series. I'm pleased today to be joined with Chris Cohen and David Larimer. It's nice to have you both here. You're both from Scottsdale, Arizona, representing Scottsdale Recovery Center. It's good to have you in Jacksonville.
Thank you. It's very good to be here.
Well, before we get started, let's talk for a few minutes about what got you interested in starting the Scottsdale Recovery Center, Chris.
I'd say about 6 or 7 years ago in Scottsdale, there was a high demand for more of an upscale, sober living style living for people coming out of treatment. And so originally what my partner Alex Salcido and I did was we created the first upscale sober living home in Scottsdale. What we found was that our success rate was kind of low for recovery, which we didn't like. And so what we decided to do was to get the license for treatment, and we kind of parlayed that into where we are today.
And you have a men and women's separate program, so it's gender responsive.
Yes,
so
absolutely.
David runs the programming side of Scottsdale Recovery. Can you tell us a little bit about how the program runs?
Sure. So we do the sober living as where they live, and then they come in to the center, and it's a partial hospitalization, intensive outpatient. It's licensed by the state, Joint Commission accredited. We have licensed therapists that provide the group, the individual, the art therapy. And then we supplement that with yoga and meditation. The gym is an integral part of what we do. And then activities on the weekend, therapeutic. Like we just had a ropes course for the weekend.
Oh, good. Team building exercises.
Correct.
Perfect. So you said that you started it out being more high end. Is it still functioning in that capacity?
Yes, very high end and upscale.
Okay.
I guess they call it the Florida model now, where we have a really nice large treatment facility in Scottsdale. We have several homes located close to the center, and they're vanned in for treatment and group therapy and individual sessions. We do a lot of trauma therapy, art therapy, as David mentioned, yoga, meditation, experiential therapy modalities and things of that nature.
Sounds like a very well-run program.
Yeah, and then they're able to go back to their, these nice homes. So it's a very, cozy. They feel at home. It's their home. It's very nice with pools and whatever, jacuzzis and nice bedding, and so they feel very comfortable after a hard day's work of therapy.
Yeah, it doesn't feel medical. It doesn't
Absolutely
feel like a
not.
Hospital.
And I'm glad you brought that up, because that's kind of our main feel and focus, is that we want them to feel very comfortable, because we know how hard it is to be in treatment at times.
Right.
But it's definitely well worth it.
Good. Well, so you all, since you have this gender responsive program, how have you seen a difference between men and women responding to treatment at your programs?
Well, first of all, when we say gender specific, they live in different houses. We have male house managers and the men's house and female house managers. Specifically, the women and the men are able to talk about issues that they wouldn't comfortably talk in front of somebody else. In particular, the men have a lot of trouble talking about trauma issues with women in the room. And there isn't the whole flirting in the group session. The women they feel safe to be able to talk about their issues.
That's good. We've just moved gender responsive as well, and I think we're starting to see the same thing. So it is clearly definitely an evidence-based modality that we need to move to more in the industry. So it sounds like you guys are on the right track.
Yeah, I mean, I think what you guys did here is an unbelievable program. I mean, this is a state-of-the-art, really beautiful. We want to thank you guys for having us, and thank Roy and Derek and So anyways,
well, appreciate that.
Great.
We're glad we could be partners with you all. And so for those that are watching today, how could they get in touch with you if they needed help?
Most people find us online on scottsdalerecovery.com, www.scottsdalerecovery.com. And then the 800 number is 888-309-3385.
Very good.
And obviously social media, Scottsdale Recovery Center on Facebook and Instagram and Twitter, Scottsdale Recovery Center.
That's great. Well, thank you, David and Chris, for being here today. Appreciate having you. For those of you that are interested in learning more about Lakeview Health, we invite you to visit us at lakeviewhealth.com. Or if you need some help right away, we invite you to call us at 866-887-0142.